planning for pregnancy, once you are pregnant, do seek the medical advice of the OBGYN or GP. If you have difficulties getting pregnant within 6 to 12 months, do consider seeking medical advice. Now, whether it's 6 months or 12 months really depends on your age group. If you are in the early 20s, then I think you can wait for 12 months to a year. But if you are already in your late 30s or 40s, please do not wait too long to seek medical advice, because the earlier it is, the better it is, easier it is for you to get pregnant. Furthermore, if you compare two age groups, the 35 years olds will not be as fertile as the 25-year-olds. And even if you get pregnant, the 35-year-olds will have a higher risk of miscarriage compared to the mid-20s. So I would suggest the moment you are settled down, don't dilly-dally anymore and start planning for your baby. The first thing I would always advise my patient to do is stop all the bad habits like smoking, late nights, and cut down on your alcohol. Now, whether you should go for preconception health checkup really depends on the two of you. If you are both Singaporeans or come from developed countries, most of the baby boys and girls would have their own vaccination and immunization done when you are a kid, and then as you grow in school, you have a health records and all this. I would say most of the Singapore boys and girls, especially the boys, especially those who have gone to national service, I would say they are healthy. If not, then for the boys, the national service will have sieved them out, and you know what are your problems. Like you may have diabetes and high blood pressure and so on and so forth. So although it's important to go for a health checkup, but in the Singapore context where the health system is good, I think the moment you tie the knot, please carry on and do the natural thing to have a baby. Maintain a healthy diet and lifestyle. I think that's important, especially for the two of you. Try to make time together, because a lot of busy career people will have, for example, the nurses, they'll be on shift duties, the pilots, they are always away. So the moment you're back in town, the two of you should spend more time together. Diet-wise, I would say most of the food in Singapore is being checked by the Ministry of Environment and various health authorities. There's nothing I would say is really taboo, except that for my Chinese patients, I always tell them try to stay away from all this unnecessary, unguided, unsupervised herbal products. And I name a few, for example, like the famous Dong Guai, the 8 Treasures Spartan, and the cordyceps Dong Chong Chao. They're expensive, but they can cause unnecessary bleeding during your menses or even when you're pregnant. So I would say please consult your TCM properly first before you start self-medicating with the medical hall advices. Now, keep track of your menstrual cycle. I think that's important, because in busy Singapore, many of us just say, yeah, it comes once a month, but you know, it can be a 28-day cycle, it can be a 35-day cycle, it can be a 45-day cycle. And there lies the difference for you to sort of gauge what's the most fertile period to be together. Okay, for example, if you're 28-day cycle, then most likely 14 days before the next cycle will be your fertile period. If you are 35-day cycle or 45-day cycle, then most likely your fertile period will be about 2 weeks. You calculate backwards from the next cycle. So a day 14 in a 28-day cycle would be fertile for you, but a day 14 for if you are 35 or 45-day cycle may not be that fertile for you. Important to take note, because you know both of you are busy people, and the time you want to spend together on those moments are very important. Then speak to your doctor and your partner. If your partner smokes, I would really discourage smoking.